I want to bring in infectious disease specialist Dr. Sumon Chakrabarti now. He's in Mississauga, Ontario. Dr. Chakrabarti, cases are rising in a number of provinces, and there are increasing concerns now about a fourth wave. What would a fourth wave look like, and how would it compare to really the horror that we went through with the third wave here in Canada?
Absolutely. What we went through the first couple of waves certainly was a bad experience. Fortunately, I'm definitely concerned about a fourth wave. This is what we are in right now in varying parts in Canada. But again, we have to really keep in mind that we have a huge amount of vaccine coverage, of the best in the world. And this is going to make the wave look different. We're not going to have the same number of hospitalizations, which is the issue that we had, especially in the third wave. And we have seen this happen around the country and around the world, that the number of hospitalizations is much less now. So we can deal with this. Hopefully this will be much the same, and this wave will be sharp and short.
As we get into the school year and we talk about those people who are not vaccinated, concern obviously turns to kids and protecting our kids. So we do have a tool. We have an incredible tool in our toolbox, and that is the vaccine. So when we see people not getting the shot, how do we reach them so that they can't spread the virus and infect children?
Yeah, I think one of the things, the biggest thing to remember is that the people who are not getting the vaccine, it's a large group with many different reasons for not doing so. And I've mentioned this before, is that it's important to not just dismiss them as anti-vaxxer. Many of these can just have a simple conversation, and I've had many of these myself with a trusted medical professional, and oftentimes people will go and get the vaccine. We've been doing a lot of community outreach. Family doctors are essential in this role, and other primary healthcare practitioners. And I think we can reach those people. With that said, it's important to realize there will be a small group that we don't reach, and I don't think that's going to make a huge difference in our coverage and our ability to overcome Delta.
Later today, Quebec is set to announce details of its vaccine passport. There's growing pressure on the Ford government, particularly from within the business community, to follow suit. What's your take on vaccine passports? Do you think that they could incent some people to get the shot?
I think certainly they will, but again, this is another one of those very complex situations, and I have some misgivings and some, like for these passports. I think that they could be used in a situation when there's a lot of transmission happening on the ground, especially temporarily in winter. But I do think there can be a lot of unintended consequences as well, especially for marginalized populations. So once there's a plan to put them in, there should also be a plan on when they should be taken out, especially if you don't need them at a time of low transmission. So it's a complicated situation.
All right, Dr. Chakrabarti, good of you to be with us today. Thank you.